Showering requires a lot of small physical movements, reaching, bending, twisting, that may seem easy, but for seniors they can be risky. Sudden or unsteady motions in a slippery environment increase the chance of falls, which remain one of the leading causes of injury and hospitalization among older adults. Beyond falls, abrupt movements can also trigger cardiovascular stress, dizziness, or even dislodge clots in those with fragile circulation. When a senior bends down suddenly, for example, to pick up dropped soap or shampoo, the body's blood flow shifts rapidly. This can cause orthostatic hypotension, a sudden drop in blood pressure when standing or bending, leading to dizziness or fainting. In a shower, fainting is especially dangerous due to hard, wet surfaces. Twisting the body too quickly can also strain the spine, hips, or knees, which are often weakened by arthritis or reduced flexibility. For someone with balance issues, even a small misstep can result in a serious fall. Another risk is circulatory stress. Seniors often have narrowed or less elastic blood vessels, and sudden changes in posture can make it harder for the heart to keep blood flowing evenly. This may cause lightheadedness or palpitations. If combined with hot water and steam, which already dilate blood vessels and lower blood pressure, the risk of losing balance grows even higher. For individuals with blood clot history, sudden motions that jolt circulation could in theory contribute to clot movement, although the primary danger remains falling. To reduce risks, seniors should focus on slow, deliberate movements in the shower. Reaching should be minimized by placing soap, shampoo, and other essentials at waist or shoulder height rather than low shelves or the floor. Installing corner shelves, wall dispensers, or long-handled bath tools can eliminate the need for bending and stretching. A shower chair can also help by allowing bathing while seated, making movement steadier and reducing strain. Additionally, practicing balance and flexibility exercises outside the shower, such as gentle stretching or Tai Chi, can help seniors stay steadier during daily routines. But inside the shower, safety must come first. Move carefully, avoid rushing, and always have something stable like a grab bar to hold on to when shifting positions. In summary, sudden movements or bending in the shower may appear minor, but for seniors they can lead to dangerous falls, cardiovascular stress, or circulation issues. By keeping movements slow, using supportive tools, and arranging the shower space smartly, older adults can bathe safely and confidently while minimizing avoidable risks. For seniors, the bathroom is one of the most hazardous places in the home. Wet, slippery floors combined with reduced balance, slower reflexes, and weaker muscles significantly increase the risk of falls. In fact, statistics show that a large percentage of senior injuries happen in the bathroom, often while showering. One of the most effective ways to prevent these accidents is by using support aids such as grab bars and shower chairs. Grab bars provide stable, secure handholds that help seniors maintain balance while getting in and out of the shower or adjusting their position inside it. Unlike towel racks or walls, which are not designed to support weight, grab bars are built to withstand pressure and prevent slips. Placing them near the shower entrance, along the wall, and beside the toilet ensures that seniors always have something sturdy to hold on to. This small modification can greatly reduce the risk of falls, especially when dizziness or sudden weakness occurs. A shower chair or bench is another essential support aid. Standing for the duration of a shower can be exhausting for seniors, particularly those with arthritis, circulation issues, or reduced stamina. Sitting down allows them to wash safely without straining their legs or risking a fall. It also prevents blood pooling in the lower body, which is a concern when standing still for too long. Shower chairs with non-slip feet and armrests provide added stability and comfort, while foldable versions are convenient in smaller bathrooms. Support aids also encourage independence. Many seniors resist asking for help with bathing because it feels like a loss of dignity. By installing grab bars and shower chairs, they can continue to shower safely on their own, maintaining privacy and confidence. For caregivers, knowing that these aids are in place also brings peace of mind, reducing constant worry about accidents. To maximize safety, it's important to install grab bars at the correct height and angle, ensuring they are securely anchored into wall studs. Non-slip mats on the floor, combined with these aids, provide an extra layer of protection. Seniors should also choose a chair that is water-resistant, easy to clean, and appropriately sized for their shower space. In summary, using support aids like grab bars and shower chairs is one of the simplest yet most effective ways to make showers safe for seniors. These tools prevent falls, reduce fatigue, and allow older adults to maintain both independence and safety in one of the most high-risk areas of the home. Good bathroom ventilation is often overlooked, but it plays a critical role in keeping showers safe, especially for seniors. When a bathroom lacks proper airflow, steam from hot water quickly fills the room, raising humidity and reducing oxygen levels. For older adults, who may already have compromised lung function or heart conditions, this combination can cause shortness of breath, dizziness, or even fainting. Fainting in the shower is particularly dangerous because of the hard, slippery surfaces that increase the risk of serious injuries. Steam buildup also makes it harder for the body to regulate temperature. In a poorly ventilated bathroom, heat lingers, raising the core body temperature more than intended. This can lead to overheating, dehydration, and low blood pressure, all of which stress the cardiovascular system. Seniors are especially vulnerable because their ability to regulate body temperature declines with age, and they may not notice warning signs such as lightheadedness or fatigue until it is too late. Humidity without ventilation also promotes the growth of mold and mildew, which can worsen respiratory issues. Seniors with conditions like asthma, COPD, or weakened immune systems are more likely to experience irritation, coughing, or infections when exposed to mold spores. Over time, this can reduce lung capacity and make everyday activities, including showering, even more difficult. Another subtle but important risk is oxygen displacement. In small, tightly sealed bathrooms, steam can reduce air circulation, leading to less oxygen being available to breathe comfortably. For seniors with heart disease or oxygen-dependent conditions, this reduction can cause chest tightness or breathlessness, further straining the body during what should be a simple daily activity. To improve safety, bathrooms should have functional exhaust fans or windows that can be opened to let steam escape and fresh air enter. Seniors should turn on the fan before starting the shower and leave it running for several minutes afterward to fully clear the air. If a window is available, opening it slightly can also improve airflow. For bathrooms without built-in ventilation, a portable dehumidifier or moisture-absorbing products can help reduce humidity. Standing for extended periods in the shower may seem harmless, but for seniors it carries several hidden risks related to circulation, balance, and overall cardiovascular health. Unlike walking or moving, standing still does not activate the leg muscles that normally help pump blood back to the heart. This can cause blood to pool in the lower extremities, leading to reduced circulation to the brain and upper body. For older adults, this may trigger dizziness, lightheadedness, or fainting, especially when combined with the heat and steam of a shower. Another concern is the strain placed on the veins. Seniors are more likely to have conditions such as varicose veins, chronic venous insufficiency, or a history of blood clots, DVT. Prolonged standing increases pressure in the leg veins, slowing blood return to the heart and raising the risk of clot formation. If a clot develops or an existing one is dislodged, it can travel to vital organs, causing potentially life-threatening complications such as a pulmonary embolism or stroke. Fatigue and weakness are also factors. As seniors age, muscle endurance and stability decline. Standing too long in a slippery environment increases the chance of losing balance and falling, which is one of the leading causes of serious injuries in older adults. The combination of wet surfaces, soap, and reduced muscle stamina makes falls in the bathroom particularly dangerous. Hot showers amplify these risks. Heat causes blood vessels to dilate, which lowers blood pressure. While this can feel relaxing, it also makes it harder for blood to return to the heart when someone is standing still. In seniors with already low or unstable blood pressure, this can lead to fainting episodes. Cold showers, on the other hand, cause blood vessels to constrict, which may further challenge circulation in those with poor vascular health. To minimize risks, seniors are encouraged to limit shower time to 10 to 15 minutes and, if possible, avoid standing the entire duration. Installing a shower chair or bench provides the option to sit, relieving pressure on the legs and improving safety. Grab bars and non-slip mats are also important additions to reduce fall hazards. Taking breaks by alternating between sitting and standing can also help maintain circulation. In summary, standing too long in the shower may compromise blood circulation, strain the cardiovascular system, and increase fall risk for seniors. By keeping showers brief, using support aids, and sitting when necessary, older adults can make bathing both safer and more comfortable. Showering immediately after eating a meal or taking medication may seem harmless, but for seniors it can present significant risks to circulation, digestion, and overall cardiovascular health. Both eating and medication absorption place unique demands on the body, and combining these with the stress of a shower can disrupt delicate balance. After a meal, the body directs more blood flow to the digestive system to support the breakdown and absorption of nutrients. This natural process, called postprandial hyperemia, means there is temporarily less blood available for other organs and muscles. If a senior showers right after eating, especially with hot water, the additional dilation of blood vessels in the skin further diverts blood away from the stomach and intestines. This can slow digestion, trigger abdominal discomfort, or in some cases cause dizziness due to reduced blood flow to the brain. For individuals with diabetes or other metabolic conditions, this imbalance can worsen blood sugar fluctuations. When it comes to medications, timing is equally important. Many common prescriptions for seniors, such as blood pressure pills, blood thinners, and heart medications, already alter circulation or vascular tone. For example, antihypertensive drugs lower blood pressure by design, and when combined with the heat of a shower, blood pressure may drop too low. This can result in lightheadedness, fainting, or falls in the bathroom. Similarly, blood thinners like warfarin or aspirin make clotting less efficient, and sudden temperature stress can increase the risk of bruising or vascular strain. Cold showers pose their own risks if taken right after meals or medication. The sudden vasoconstriction may reduce blood flow to the digestive system, interfering with proper absorption of nutrients or slowing the uptake of certain drugs. In seniors who rely on consistent medication levels, this disruption can reduce treatment effectiveness. To minimize risks, it's best to wait at least 45 to 60 minutes after a meal or taking medication before showering. This allows the body to complete initial digestion, stabilize blood pressure, and properly absorb medication without added circulatory stress. During this waiting period, seniors can engage in light activities such as walking, reading, or gentle stretching to encourage steady blood flow. Sudden exposure to cold water may feel invigorating, but for seniors it can be dangerous. When very cold water hits the skin, the body reacts immediately with vasoconstriction, meaning the blood vessels tighten and narrow. This response causes blood pressure to spike rapidly as the heart works harder to pump blood through the restricted vessels. For an older adult with fragile arteries, hypertension, or heart disease, this sudden surge can trigger chest pain, irregular heartbeat, or even a cardiac event. The shock of cold water also stimulates the sympathetic nervous system, commonly called the fight or flight response. This reaction increases heart rate, stress hormones, and blood pressure within seconds. While this can feel energizing to some, in seniors it may overburden an already weakened heart. The combination of higher cardiac demand and vessel constriction creates an environment where blood clots are more likely to form. Or existing clots could be dislodged and travel to critical areas, such as the lungs or brain. Another risk of sudden cold showers is respiratory distress. The body's natural reaction to cold shock is a sudden, involuntary gasp followed by rapid breathing. For seniors, particularly those with lung conditions such as COPD, asthma, or reduced lung capacity, this can lead to breathlessness, dizziness, or even fainting in the shower. A fainting episode in a slippery environment significantly increases the chance of injury. Additionally, cold water can worsen circulation issues. Seniors with peripheral artery disease, diabetes-related neuropathy, or poor blood flow in the legs may find that sudden cold exposure reduces blood delivery to the extremities even further, leading to numbness, tingling, or discomfort. Over time, repeated cold water stress could worsen vascular stiffness, which is already a concern in aging bodies. Instead of stepping directly into icy water, seniors are advised to use gradual temperature changes. If cooler showers are desired, for example, to feel refreshed in hot weather, they should be introduced slowly, starting with lukewarm water and then gently adjusting the temperature downward. This gives the cardiovascular system time to adapt without causing dangerous spikes in pressure. In conclusion, while sudden cold showers may be popular in wellness trends for their claimed benefits, they pose significant risks for seniors. The combination of blood vessel constriction, blood pressure spikes, and respiratory stress makes them unsafe. Choosing moderate, comfortable water temperatures and avoiding abrupt cold exposure is a safer practice to protect heart health, prevent clot complications, and reduce accidents in the bathroom. Sudden exposure to cold water may feel invigorating, but for seniors it can be dangerous. When very cold water hits the skin, the body reacts immediately with vasoconstriction, meaning the blood vessels tighten and narrow. This response causes blood pressure to spike rapidly as the heart works harder to pump blood through the restricted vessels. For an older adult with fragile arteries, hypertension, or heart disease, this sudden surge can trigger chest pain, irregular heartbeat, or even a cardiac event. The shock of cold water also stimulates the sympathetic nervous system, commonly called the fight or flight response. This reaction increases heart rate, stress hormones, and blood pressure within seconds. While this can feel energizing to some, in seniors it may overburden an already weakened heart. The combination of higher cardiac demand and vessel constriction creates an environment where blood clots are more likely to form. Or existing clots could be dislodged and travel to critical areas, such as the lungs or brain. Another risk of sudden cold showers is respiratory distress. The body's natural reaction to cold shock is a sudden, involuntary gasp followed by rapid breathing. For seniors, particularly those with lung conditions such as COPD, asthma, or reduced lung capacity, this can lead to breathlessness, dizziness, or even fainting in the shower. A fainting episode in a slippery environment significantly increases the chance of injury. Additionally, cold water can worsen circulation issues. Seniors with peripheral artery disease, diabetes-related neuropathy, or poor blood flow in the legs may find that sudden cold exposure reduces blood delivery to the extremities even further, leading to numbness, tingling, or discomfort. Over time, repeated cold water stress could worsen vascular stiffness, which is already a concern in aging bodies. Instead of stepping directly into icy water, seniors are advised to use gradual temperature changes. If cooler showers are desired, for example, to feel refreshed in hot weather, they should be introduced slowly, starting with lukewarm water and then gently adjusting the temperature downward. This gives the cardiovascular system time to adapt without causing dangerous spikes in pressure. In conclusion, while sudden cold showers may be popular in wellness trends for their claimed benefits, they pose significant risks for seniors. The combination of blood vessel constriction, blood pressure spikes, and respiratory stress makes them unsafe. Choosing moderate, comfortable water temperatures and avoiding abrupt cold exposure is a safer practice to protect heart health, prevent clot complications, and reduce accidents in the bathroom. Taking very hot showers might feel relaxing, especially for seniors who experience muscle stiffness or joint discomfort, but it can be risky for cardiovascular health. When exposed to high water temperatures, the body's blood vessels dilate significantly. This sudden vasodilation lowers blood pressure, which can make you feel dizzy or lightheaded. For older adults who may already have reduced balance or underlying circulation issues, this increases the chance of fainting in the shower, potentially leading to dangerous falls. Hot showers can also strain the heart. When blood vessels expand, the heart must work harder to maintain circulation, which raises heart rate. For seniors with pre-existing heart disease, hypertension, or arrhythmias, this extra workload may trigger palpitations, shortness of breath, or even cardiovascular events. While younger, healthy individuals can usually tolerate these changes, the elderly population is more vulnerable to sudden blood pressure shifts. Another concern with very hot showers is the risk of clot disruption. Seniors are more likely to have sluggish blood flow, venous insufficiency, or a history of deep vein thrombosis, DVT. Sudden dilation and constriction from extreme temperature exposure can dislodge small clots, raising the risk of them traveling to the lungs, pulmonary embolism, or brain, stroke. Although not every hot shower will cause this, the danger is greater for individuals with compromised circulation. Heat also dehydrates the body by increasing sweating, which thickens the blood slightly. For seniors who may already struggle with staying hydrated, this can further elevate clotting risk. Prolonged exposure to steam and heat in a poorly ventilated bathroom can reduce oxygen levels as well, compounding the risk of dizziness or fainting spells. To reduce these risks, experts recommend using lukewarm water instead of very hot water. A mild, warm shower is still soothing to muscles but does not cause drastic changes in blood pressure. Seniors should also avoid staying in the shower for long periods and keep the bathroom well ventilated to prevent excessive steam buildup. In short, while hot showers may feel comforting, they present hidden dangers for seniors, especially those with heart conditions or circulation problems. Sticking to moderate water temperatures is a safer habit that helps maintain cardiovascular stability, reduces fall risk, and prevents unnecessary stress on the body.